This is Radio Health Journal. I'm Nancy Benson. This week, fighting the deadliest disease in history. It may not be what you think.
There's always the worry that the influenza virus will change, will mutate into a strain that is more deadly.
Why the flu is so hard to beat when Radio Health Journal returns.
I'm Reed Pence, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
You know, I thought I was there to talk about the literature and the writing process, but I quickly figured out that the students really needed was somebody to speak honestly with them about sexual violence.
Teaching our youth about consent and abuse. Then,
psychology of fashion is really about human behavior within and across the fashion industry.
We talk with one of the scientists who's helping this form of psychology through its pioneer stage. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
Even though it's nearly May, believe it or not, it's still flu season. So it still pays to wash your hands frequently and stay home if you don't feel well. But as common as the flu is, to many people, it remains a mystery. For example, why do we need a flu shot every year when one vaccine for viruses like measles or mumps lasts a lifetime? And why is the flu vaccine only partially effective? Well, experts say it's all because the flu virus is in a class by itself in some ways. It's said there's nothing quite like flu in terms of risk.
There's always the worry that the influenza virus, which is a master of disguise and a master of mutation, will change, will mutate into a strain that is more deadly or more infectious than previous strains. And so I think that combination of it being a common disease with the ability to spread quickly and to change into a very much more potent and deadly disease, I think that gives us the risk.
That's Dr. Jeremy Brown, Director of Emergency Care Research at the National Institutes of Health and author of Influenza, the 100-Year Hunt to Cure the Deadliest Disease in History. He says it's well known that a flu vaccine is only 50 to 60% effective in protecting you from getting the flu. And last year, it was only 20 to 30% effective. But Brown says even a poor defense is better than none.
Everybody agrees in the business of flu that the vaccine is a pretty poor vaccine. I mean, if you think about what we have in our momentum against diseases, we have the mumps, measles, and rubella vaccine. We have the polio vaccine and many others, which essentially you're given as a series of childhood shots, maybe one or two or three, maybe take it only one time, and then you are good to go for life. You are immune, essentially immune to these nasty diseases. Contrast that with the influenza vaccine, which we know has to be given every year. It has to be updated. The contents of the shot itself have to be updated so that they can match what the scientists believe will be the circulating viruses several months later. And then it varies by age group, how well the vaccine works within specific age groups. It also actually varies by geography. You know, the further north you are, the less well these vaccines seem to work.
But why don't flu vaccines work the same as those for measles and mumps? Brown says the problem is that proteins of the influenza virus mutate much more rapidly than proteins of those other viruses.
So that when we target some of those surface proteins in a vaccine, what we are targeting can change. It's a bit like telling the police that you're looking for somebody wearing a black shirt and the person switches disguise and goes out in a blue shirt. And now you're looking for the wrong person. Similarly, a vaccine will target only specific proteins. And when those change or mutate, or perhaps a virus came in that we didn't expect with none of the proteins on that we're vaccinating against, that's when you get this mismatch. And that's when, like we happened last season, that's when the vaccine's efficacy really dives down into low 20s or 30%. So some viruses are very stable over time, and we can really target them. And others are real masters of disguise and make vaccine production against them much, much more challenging.
And once the influenza virus gets inside a cell to replicate, it takes over quickly, replicating and possibly mutating with each duplication. But vaccine makers can only make what's really a highly educated guess as to the direction those mutations will go as they attempt to anticipate which kinds of virus will be in circulation next season.
What we are doing in medicine is constantly trying to catch up with the last flu outbreak and think about what might come around the corner when we can really be served some very unexpected viral types. While flu is definitely not the emperor of all maladies, as Mukherjee titled his Pulitzer Prize-winning book, but I think it is definitely the malady of all empires. Flu and the Great Flu epidemic was a disease that spread worldwide. Virtually every city in the world was somehow affected across all continents, and it really did manage to spread in this worldwide fashion, and 100 years ago caused the deaths of between 50 and 100 million people, and approximately 675,000 people in the United States.
That's why 3 or 4 generations ago, we didn't take the flu quite so matter-of-factly. For example, in the 1946 movie It's a Wonderful Life starring Jimmy Stewart, you'll recall the scene where a young George Bailey gets his ears slapped by the druggist, Mr. Gower. Gower had just received a telegram from the Army saying his son had died of influenza in the flu pandemic of 1918. The cover of Brown's book depicts that toll, crowded hospital barracks filled with sick soldiers. Brown says the question of why so many died in that pandemic stymies researchers today.
There are several theories, each of which has some support, but none of them are wholly compelling. We're still not 100% certain as to why that particular flu virus was so infectious and so deadly at that particular time in history.
Brown says even today, researchers don't know the exact number of deaths caused by influenza each year.
We don't really have a good handle on how many of those deaths are actually caused by the virus itself and how many are caused by the complications of influenza, like a bacterial infection. We do know that sometimes young people, and most tragically perhaps of all children, die from this disease, otherwise healthy children. But we have to remember that those are thankfully extraordinarily rare. And that in the overall scheme of things, 99.9999% of people will experience the flu as nothing than a minor inconvenience. It would be great not to have to experience that minor inconvenience. But for the vast majority of people, that's what influenza is. And you only need supportive care, as I said. Drink lots of fluids, take care of your fever, and don't go walking around in emergency departments or to your private doctor's office spreading the flu to everybody. Stay home and let it take its natural path. That overwhelming number of people is all that you need to do when you get the flu.
Brown says a universal influenza vaccine, one you get just once in your lifetime to cover all strains of flu, is still a long way off. In the meantime, continue to wash your hands frequently and stay home if you feel sick. You'll be doing everyone a favor. Jeremy Brown's book, Influenza, is available now. You can learn more about all our guests by visiting our website at radiohealthjournal.net. Our writer-producer this week is Polly Hansen. Studio production by Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Paid non-attorney spokesperson paid for by the Sentinel Group. Attention military vets and current soldiers who served between 2002 to 2016. Have you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces? You may be entitled to compensation. 3M, the manufacturer of earplugs made for combat, recently paid the government $9.1 million to settle a False Claims Act case for knowingly selling these defective earplugs for over a decade. Specifically, the United States argued that the manufacturer knew their earplugs were too short for proper insertion into users' ears, and that the earplugs could loosen and therefore didn't perform properly or reduce noise the way they should have. If you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces, you need to choose the right legal team that has the experience, support staff, and resources to seek the most compensation for your injuries. Call the Sentinel Group now for more information and a free case review. Call 800-655-6458. 800-655-6458. That's 800-655-6458.
Individuals and businesses with tax problems, listen carefully. Do you feel like you're losing control of your finances? If you owe over $10,000 in back taxes or have unfiled tax returns, we can help you take back control. The IRS is the largest and most aggressive collection agency in the world, and they can seize your bank accounts, garnish your paycheck, close your business, and file criminal charges. Take control of your tax problem now by calling the experts at U.S. Tax Shield and take advantage of the Fresh Start program and new laws that may allow us to negotiate a settlement for the lowest amount possible. Our team of tax attorneys and enrolled agents can stop collections and get you protected so you can take control of your financial future. U.S. Tax Shield offers a price protection guaranteed quote to get you protected today. U.S. Tax Shield is A+ rated with the Better Business Bureau, so call now. 800-568-1647. That's 800-568-1647. U.S. Tax Shield. 800-568-1647.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free, and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Facebook and Twitter, and check iTunes for a library of past programs. Plus, you'll always find podcasts of our segments, information about our guests, and the latest health news at radiohealthjournal.net. Join us again next week for another edition of Radio Health Journal.